Good morning, everyone. Namaste. This is going to be a trigger warning, so if you're not prepared for it, a trigger warning for PTSD, depression, anxiety, it's completely fine. Just go ahead and scroll. But we're going to go ahead and call in Archangel Michael to cleanse the space of any negative or lower vibrations from our mind, body, and soul, home and hearts. And again, guys, this is not a way to self-diagnose yourself. Please seek out treatment from a professional, a psychiatrist, your doctor. So this is we are going to be reading on The Body Keeps the Score, Brain, Mind, and Body. And we are currently on diagnosing post-traumatic stress disorder. It states, a turning point arrived in 1980 when a group of Vietnam veterans, aided by the New York psychoanalyst Chaim Schotten and Roberts. And this is just to tell you also that PTSD or post-traumatic stress disorder is not just for war veterans. It is also for anybody that is harboring horrible trauma that is affecting their mind, their body, and their soul. So that is something that is often misunderstood. And I just want to point that out. So it says, Lipton successfully lobbied the American Psychiatric Association to create a new diagnosis, post-traumatic stress disorder, or PTSD, which is described a cluster of symptoms that was common to a greater or lesser extent to all veterans. Systematically identifying the symptoms and grouping them together into a disorder finally gave a name to the suffering of the people who were overwhelmed by horror and helplessness. With the conceptual framework of PTSD in place, the stage was set for a radical change in our understanding of our patients. This eventually led to the explosion of research and attempts at finding effective treatments. Inspired by the possibilities presented by the new diagnosis, I proposed a study of the biology of traumatic memories to the VA. Did the memories of those suffering from PTSD differ from those of others? For most people, the memory of the unpleasant event eventually fades or transformed into something more benign. But for most of our patients, we were unable to make their past into a story that happened a long time ago. It's very real, guys. They're dreaming it. They feel it. They can smell the smells of it. It is affecting their whole overall psyche. And it states, since then, it says, the opening line of the grant rejection read, it has never been shown that PTSD is relevant to the mission of the Veterans Administration. Since then, of course, the mission of the VA has been organized around the diagnosis of PTSD and brain injury, considering the resources are dedicated to applying evidence-based treatments to traumatize war veterans. But at the same time, things were different and unwilling to keep working in an organization whose view of reality is so at odds with my own. I handed in my resignation in 1982, and I took a position at the Massachusetts Mental Health Center, the Harvard Teaching Hospital, where I had trained to become a psychiatrist. My new responsibility was to teach a fledgling area of study, a psychopharmacology, the administration of drugs to alleviate mental illness. So I'm going to leave that at that. We'll get into it further. But again, I'm somebody who struggled with PTSD for a very long time. And they wanted to put me on a round of prescriptions, but it was for 6 months I was to take it, and I wouldn't be able to get pregnant during the time, and so I didn't do it because that was when I was trying to get pregnant. but I had extreme anxiety, panic attacks, depression, and it affected me in every possible way. My work, everything. I personally went to therapy for about 10 years for it. So I did do that due diligence. I also seen my doctor, and stuff, but I also felt like I kind of had to take things into my own hands because I felt like I was just being treated and I wasn't being healed. So that is when I got into acupuncture, and acupuncture went a long way. My panic attacks were able to go away. My depression was able to ease up. But I felt like it was something that I had to continue to do about every 6 months. And it wasn't covered by my insurance. So I stumbled on Reiki, which is where I then realized I could give Reiki. And then I got certified to give Reiki, and I was able, after a year of giving myself Reiki, was able to heal myself, be able to get off all the prescriptions, and to be able to live a more balanced, happy, healthy life. So I hope this helps. I love you all. Have a blessed day, and namaste.